So these are the two main categories of people who are absolutely eligible to receive a third dose or booster shot right now. So I think what's kind of interesting is that what has happened in the last several days, at least this week, is, and this was the current administration made an announcement about having this open to the general public starting September. Someone correct me, but I want to say September 20th. I may have that wrong, but it is of this month. And what's kind of interesting about that is the administration has made that announcement without the FDA's endorsement or full recommendation of that. I know we've all heard that the Pfizer vaccine has been officially approved by the FDA for its safety and efficacy. And what I think is kind of interesting is that the announcement for kind of this general public of 8 months since your completion of your vaccine that you're eligible for a booster. The FDA has not officially come out with its recommendation yet, and now there's additional talk of whether or not to boost that up from 8 months to 5 months, but I think that's going to be turned down. And so the FDA certainly has a lot of say in this and its determination, and they have not officially voted on that as of yet. So it's a little confusing, and no one no major health organizations are campaigning yet, because I think they need to have some clear understanding without any confusion as to exactly the time frame this is going to be rolling out. Now we're planning on being able to offer boosters to the general public, and the earliest we'd be looking at doing that through our agency is in the month of November. So we have some time. We have some time to figure this out, but that is the general sense. I'd like to see more clarity moving forward and being a little more absolute in its determination and timing. So, and I'd like the FDA to weigh in on this as well. So that is yet to officially occur. More than likely it will, but it's the steps, the process in which this approvals have not occurred yet, or a bit lopsided and backwards. So, but we'll see how this all goes. Now, just looking at and browsing through headlines that have been ongoing in the past week, a study out of the University of Oxford through the UK Office of National Statistics. So this would be kind of really equivalent to what the CDC would be, but in the UK. So just looking at this study, it's kind of interesting that they found that getting 2 COVID vaccine doses was the most effective way to prevent infections caused by the Delta variant. Now, in this study, it actually shows that it does have the efficacy is still very good in its protection. Now, what they also were looking more specifically at were individuals who have had COVID, recovered, and gotten the vaccine afterwards. It's actually, at least in this study, that protection against infection was highest among this group. So this double inoculation, COVID recovery, and vaccine had actually shown to be the most protective against Delta. Now, I find that, not that I didn't think that would be true, but now papers are going to start to come out and show more data and evidence suggesting that having infection and having a vaccine following that, that your protection goes up more, even more dramatic than just being vaccinated alone. So this kind of goes more directly, at least this study goes to the individuals that have already had COVID, thinking that they won't get it again. Well, we know that's not the case. People who've had COVID can get COVID again. But if there's a true concern, or if you want the best protection possible, it would be wise to get a vaccine after having had COVID. You would be the best category, the best class of individuals to be protected against Delta and moving forward. So the other thing that came out of this is, regardless of previous infection, 2 shots of Pfizer or AstraZeneca offer good protection against Delta. So I know we don't talk much about AstraZeneca, but that was one of the vaccines created out of Oxford that has been one of the more principal vaccines offered in the UK. So, whether it's AstraZeneca, Pfizer, you can pretty much assume that Pfizer is equivalent to Moderna. They offered good protection against the Delta virus. So as far as boosters, so the overall effectiveness of coronavirus vaccines has not dropped much for most vaccinated individuals. At least that's what the CDC is saying as early as this past Monday. Now, as I mentioned, the CDC's advisory committee, the ACIP, met on Monday to discuss the potential eventual need for a booster dose, but they have not voted on that. And the administration, the White House, has said it's planning on offering booster at the end of September. And I just mentioned that, but the FDA and CDC have yet to decide on that. So it's kind of a little confusing as to who's giving authority here to give this booster when it kind of ultimately falls on the FDA and the CDC to do this. So what's important to know where we are right now with regards to just being vaccinated, we're not talking about boosters, we're talking about just being vaccinated, that it is still very effective in preventing hospitalization and severe disease. And I think that's probably the biggest takeaway when you start thinking about yourself and your family and your extended family is, are we going to be able to prevent getting ill? Now, you can certainly go to a very high level of protection regarding that if the fear of just getting infected or to prevent infections, which I'll say right now is practically impossible. It will never happen. You can go to extremes as to how to prevent it. But I think in keeping in perspective here, it's not so much about, yes, we want to protect people, we want to prevent infections, but if you get infections, vaccines are the best way to help prevent severe disease and hospitalizations and severe illness. And so it's kind of 2 different mindsets of thinking. One is if you're thinking that we have to do absolutely everything in our it's humanly possible to prevent infections. Well, you can certainly go to a very high level extreme, and it's almost impossible to prevent every infection. It's just impossible. The other mindset is, well, if we're not going to be able to prevent transmission and infections, can we prevent severe illness and hospitalization? And the answer is yes, and that comes in the form of vaccine. So kind of two different mindsets, and depends on where you fall in that spectrum and at what level. Do I personally anticipate that I could come down with COVID? I've kind of resigned to the idea that at some point, possibly, I probably could very well come down with COVID. And knowing that I'm vaccinated, I know that my chances of recovery are extremely good. It's already good. The survival rate of COVID is extremely high as it is. But looking at how can I prevent severe illness or even hospitalization, that's kind of where I'm at right now, at least personally, when I think about COVID and what I want to prevent. So now, in this same, in a study here in the United States, the vaccine's been shown to be effective against hospitalizations in adults 65 and older. Now, that has decreased a little bit over time since the introduction of vaccine, but looking at raw data and looking at unpublished data still shows the effectiveness of the vaccine still remain extremely high, and in some areas as high as 94% or higher in adults 18 to 74. So, we get information either from studies or we get them from raw data and unpublished information. And, looking at the effectiveness of the vaccines and where we are right now, my sense right now, if the FDA and the CDC were so absolute on the sense that there would need to be a booster, knowing that the effectiveness does wane over time, what I think is kind of amazing, if that's the case, then why hasn't the FDA made this decision even sooner? And so that's a little bit concerning, not concerning, but puzzling to me, in that if this was such a hard line decision as to yes, we do need boosters, why hasn't it been made? Because if it was already determined that is kind of that is the direction and the recommendations, then it should have come out already. And these decisions, and so everyone here in the United States, health organizations, health systems, community health centers, agencies like ourselves can prepare and anticipate that this is coming. Without an absolute kind of direction and decision, it makes it hard to navigate through. So what I've been browsing the CDC website, and what I find kind of interesting, and I know people have probably read this article about a month ago out of the LA Times, showing that between December 14th of 2020 and as late as August 29, 2021, that the highest vaccinated group in the country are Native Americans, with at least one dose of 52.6% of the Native population, and as high as 44.6% are fully vaccinated. Now, I think the caveat in reading that, and although that looks, and that would be great if this was the case, I'm not so confident that it actually is, because in the very beginning, I don't know if people remember this, but that first wave of individuals, the first wave of individuals up front for the first 60, almost 90 days, they weren't reporting on people's race or ethnicity. So there is a big chunk of individuals that, yes, they were vaccinated, but we can't absolutely confirm what race or ethnicity they were. So they're taking this, it's a snapshot in time of the best information that they actually have. So in this, we're looking at data that may be 2/3 that are reproducible, and at least confirmation that they are who they say they are by race or ethnicity. So take this with a grain of salt, but at the same time, it certainly indicates that natives do have a high population, a high rate of vaccination in the country. Now, this is looking at the weekly cases of COVID per 100,000. So this is looking at the case rates by ethnicity in the country. And so this is over time from as far back as April to as early as August 28th. And so you can see, based on the legend, that natives are in this kind of solid yellow line, solid line. And you can just see and track this over time, how this actually looks. And you can see in November, December, and January that natives had some of the highest case rates in the country during that time, along with Hispanics. Now, what is a little concerning in why I kind of hesitate in even presenting that last slide is that if natives were at such high percent of vaccination, you would think that the population will be even lower in case rate as time has gone by. And what we're seeing is that does not seem to be the case. Because if you look at what is occurring over the last month to the far right here, we see that the native population has actually excelled above all other races in terms of case rates. And so it's a little concerning when you look at data, and there's a strong correlation between the information that is presented. I think we can go by at least the case rate here and at least say, yes, there's been high case rates in natives over time, and in particular the late fall, early winter, and then we fall in line just like everyone else, and then now we have exceeding the case rates of all their races. So this is concerning for the native population everywhere. Now, this is a little bit of a busy slide, but I want to walk you through this because what I am trying to look more closely at are populations, age demographics, because we know in the very beginning how we had phase 1, 1A, 1B, 1C, we high-risk individuals, hospitalization, nursing home individuals, and age base was the strategy up front to get everyone vaccinated. So you can see there are demographic age groups here. The dotted line is the 7-day average or the case rate of cases at that time. And then the solid blue is the percent of people fully vaccinated in that age group. So you can see when you look left to right that case rates were pretty high in just about every group, but you can see this starting to shift once more people in that age group started to get there were more vaccinations, or people that were fully vaccinated. You start seeing this plummeting of cases. And so if you look at each age group, you can see that that trend holds pretty good for the older population. Essentially, like people that are over the age of 50, the higher their vaccination rate, you see those case rates really, really drop down. What's kind of interesting when you start looking at this now over time, we've gone to 65 and older and start working our way down to younger population and to the general public for the vaccine. You can see that these vaccination rates start dropping with each age group over time. And you can see that dotted line, that 7-day case rate per 100,000 starts to go up. And once you start getting to the age group of 20, and then you look at people at the under age of 18, we start seeing that the number of cases are much higher than all the other population, all the other age groups, and in line with knowing that people aren't vaccinated or people are vaccinated at a much lower rate. So what we're seeing now, vaccinations, yes, they help. Age group, yes, there's a difference here. When we start getting into the younger age, we see less of that population being vaccinated and a higher rate of infection. And that's really, you really start to get that sense once you start getting into the 30 and 20 years of age. And we're seeing a lot more cases of COVID in the younger population. Now, I would say that this doesn't, this shouldn't surprise anyone, because the younger population was kind of the last group, that last bolus of individuals that are getting vaccinated, and so it's not surprising that in the very beginning it was mainly older individuals, and then it started shifting, and it has continued to shift all the way to the younger population. So that's what I'm seeing right now. So when I look at vaccinations, not only throughout the state, but in looking at efforts and vaccination rates here in the Milwaukee County area, side-by-side slides, looking at, on the left, the percent of vaccinations that are occurring in Milwaukee County by zip code, by district, census tracts. On the left-hand side, on the right-hand side, we're looking at kind of more of the city of Milwaukee and how many doses of vaccines have been occurring. So what I know is that the correlation between low vaccination rates and high transmission rates are occurring in the more lightly shaded areas. And that's what I'm seeing and sensing, that over the last month and a half, that is the trend and has continued to be the trend here in the Milwaukee County area. Now, if we look at the state in more general, we start getting a better sense of who's getting vaccinated and who's not. Well, we can see that, Madison, Dane County, almost the entire county, I mean, it is very well protected at over 50% in the outer suburban areas and 70% in the more of the inner aspects of Madison. When we start looking at more broadly throughout the state, we can see that those shades become lighter and lighter as you go from major city to more rural area. It becomes less and less. So looking at what the variants of concern here obviously is Delta being in the highly blue shaded box on the right. Delta is the primary variant here. If we start looking at what's the rate of Wisconsin by at least a single dose, 54.8% as of yesterday. And those who have completed the series, 51.5%. And you can see that, it's been a couple weeks since I've last spoke to everyone, but there has been a general pickup in the rate of vaccinations that are occurring across the board of all races and ethnicities. And this is really what we want to see, is that kind of a higher level of vaccinations occurring across the board. So even in our native population, that rate is increasing, and I suspect that the last 3 weeks have been an effort to get everyone as well protected, even children, before they get back into school. So looking at what that looks like here in Wisconsin. So we know 6.1 million doses given. That's on the average almost 9,300 doses on the average every day. When we look a little more specifically as to where this distribution is occurring, adults 18 and older, if you look on the table, the lower half of this slide, the table, adults 18 years of age, yes, there has been an uptick in the number of doses being given, but we also see an uptick on the left-hand side of this table of 12 to 15-year-olds with nearly almost 1,000 doses given. And so this, I think, is really an effort to maximize the number of kids that are getting vaccines and protection going into the school year. So that shouldn't be surprising. This I just wanted to highlight, looking at the population, overall population of 52.6% of the population is fully vaccinated right now. If we look at 18 years of age and older, 63.6%. Still looking, if we're looking at the number as to being kind of the true indicator of herd immunity or critical threshold, you really need to focus on the percent of total population and getting closer to that 70% fully vaccinated to really get that sense of crossing that threshold. This is the CDC looking at the daily 7-day average of vaccines given. And I just highlighted a few benchmarks here. On April 11th, the 7-day average was almost 3.5 million doses given on an average every day. And then since then, it's gone to a lull of July 9th at 439,000 doses on the average every day, to now almost 800,000 doses given on a daily basis. So doses, people getting vaccines are increasing. And, a couple things with that. Obviously, Delta and concerns about Delta virus occurring is important. Another thing, going back to school and looking at children and young adults, college-age students being vaccinated, going back to school, that has gone up. And the other thing that occurred more recently in the last couple of weeks was the FDA approved of the Pfizer, officially approved Pfizer's vaccine. So we have several kind of mitigating reasons as to why this is going up. The question is how long, and will this continue to go up, or has this effort peaked at this time? It's hard to say. Looking at the native populations in the Bemidji area, looking at Michigan, 5,143. There's been 253 new cases in the last 3 weeks. It's averaging about 84 cases a week. In Minnesota, 351 new cases, averaging about 117. Here in Wisconsin, 337 new cases in the past week, or 112 new cases on the average. So, this is pretty good, a strong indicator that this is just hanging around. And I guess the more pointed question have we reached the peak of this, the rate of infection, or is this going to continue to increase? I would suggest more of we're at that peak right now. And I think the next week will show whether that pans out or not. Here again, I just look at the 7-day average of Wisconsin, just picking some highlighted points. And as of August 31, there was 1,968 new cases, bringing the 7-day average to almost 1,700. But if you look at the bar lines that have occurred over the last 3 weeks, or certainly over the last week, that clustering of about 2,000, it looks, and at least the general sense, that this is peaking. This is peaking right now, and that we may see it flattening, and maybe hopefully by next week that it will start to decrease. Now, obviously, the holiday weekend, the long weekend, families, get-togethers, going out, Summerfest is here. Brewers are playing baseball and football, and people are traveling and going all over the place. And so, how is this going to play out? I think by next Thursday, we can certainly have a better indication of how this is all going to play out. So, vaccinations here in Milwaukee County, Native population with at least a single dose, 58% of the Native population with a single dose, 52% have completed or fully vaccinated. And looking in comparison to other races and ethnicity, I mean, the Native population has certainly stepped up and are in, very high rate here compared to other races and ethnicities. You can just get this general sense of how this is all playing out here in Milwaukee County, and the Native population has certainly stepped up and gotten that vaccine. So I'm very happy to see that we're on the left-hand side of this graph moving forward. I know I haven't presented much on what COVID has been doing in other regions of the country, but you can see, based on IHS's regional data, how we compare. Bemidji, 12,857 Native cases that have been reported, and how that compares to other regions of the country. So probably the areas with the highest number, obviously Oklahoma City, with almost 76,000 cases, followed by the Navajo area of 35,000, and Phoenix with almost 25,000. So we're kind of smack dab in the middle of comparative to other regions of the country and Native population. So I know I talk about how here in Wisconsin we've been have a very high rate. You can imagine in other areas of the country, especially in Oklahoma or Navajo, that their rates are even higher. So, well, we have done relatively kind of middle of the road, but I feel is high. There are other regions of the country, Native populations, that have fared much better than we have. So we're smack dab in the middle, kind of how I would anticipate, given the population here, the number in population comparative to these other regions. So I wanted to focus in on a couple things, and this kind of goes along the theme of case rates and age demographics. So when we look at what's the case rate of all ages, this is collectively overall. Looking at the top half here, we see that Hispanic have the highest case rate, followed by the Native population as having the highest, second highest case rate of all ages. Now, so when we look at hospitalizations of all ages, Black population has the highest rate, followed by Natives with the second highest case rate. What I want people to start to focus in on is the line graph on the bottom. So you can see here, and this is just Wisconsin, and I showed the same graph, how things were looking on from the CDC on a national perspective. You can see the native population in orange here, that orange line, had very rough time in October, November, and early part of December, and then it flattens out over time. And then what is occurring more recently is there was an uptick in the native hospitalizations, but there was an even higher rate amongst the African American community. So again, this is looking at all ages collectively, how things are going and trending for races and ethnicities here in Wisconsin. And so I wanted to get, the people not just thinking collectively, but I'm going to zero in on areas that I feel are probably more of concern. So here are the fatality rates. Native population has the highest fatality rate amongst all races and ethnicities by all ages. And again, you can see in that late fall, early winter that there was quite a few fatalities that were occurring in the native population. That correlates with hospitalizations as well as case rates. So there was a lot of going on in the native population. Now, what I want to focus in on a little bit more, and these are a bit nuanced, but I think they're important. So when we start looking at ethnicity in Wisconsin of 18 years of age and younger, we see that collectively overall that the native population 18 years of age and younger had the second highest case rate. Okay. Now, if you look at the lower half of this and you look at the bar graph at the bottom, or line graph, you can see as of what's occurring in the last 4 weeks is we have two distinct ethnicities, the African American population as well as the native population. The case rates have excelled beyond everyone else. And this is a bit concerning. So we have the African American with a case rate of 530 cases per 100,000, the native population 462 cases per 100,000, non-Hispanic whites at 295, and everyone else is much lower. So even though if we look at overall case rates, yes, but it doesn't give you the whole answer. You want to know where these infections are coming. Well, it looks like there's a strong uptick of new cases occurring in native populations 18 and younger, especially in the last month. Obviously, that correlates with Delta and the Delta virus. So, these are kind of the nuanced things that I want people to understand and see, because these are the trends that are occurring right now. So now, how does this correlate cases to hospitalizations? Now, the upside to this is when we look at natives 18 years of age and younger, they have a case rate per 100,000 right in the middle. Now, even though there may be higher cases of young natives now, it's not correlating the hospitalizations. In fact, right now, there are 0 cases per 100,000 right now. There's been no hospitalizations. But if you look at other races, we see that the African American community and the Hispanic community have much higher case rates per 100,000 than the native population. So even though young natives may be getting infected with COVID, it's not translating into hospitalizations. Okay. Now that's 18 and younger. If we look at 35 to 44 years of age, looking at the case rate, native population in this case rate is right in the middle. But what if we look at what has been occurring over, the last 4 to 6 weeks, we see two groups, African Americans and the Native population, exceeding all other races and ethnicities in this group of cases. Okay, so we have 18 years of age and younger. We also have this group, 35 to 44 years of age. Now, does having a high case rate necessarily translate into a higher hospitalization? Well, cumulatively over time, yes, Natives have had a higher hospitalization rate in this age group. And if we look at what's occurring in the past couple of last 4 to 6 weeks, we see this high spike of Natives being hospitalized, and highest ethnic group in the state of being with their case rate being so high. However, in the last week, that has dropped down, and now the African American population is 22.6 cases, while the Native population is 14.1. But at one point, Natives did represent the highest rate. So, while my point being, younger population may be getting 18 and younger, may be getting higher transmissions of COVID, that's not translating into hospitalization. However, as people get older in the 35 to 44 years age group, case rate does translate into higher hospitalization. So these are the nuances of when you start looking at and stratifying and trying to develop kind of a strategy of risk adverse to groups. This is how you start looking at this by demographics, by age, case rates, hospitalizations, and you start seeing the trends that are occurring. Now, again, I follow numbers and have been doing it for over a year. If we look at the left-hand side, we see the age groups of 20, 30, 40-year-olds. We see number of cases, 123,619. That represents 17% of all cases related to COVID in the 20. That's the number one group. The second group, 30 to 39 at 15.3%. So two age groups, back to back, 20 to 30 years old, highest case rate, looking at almost 1/3 of all cases of COVID in the state that have occurred in this age group. When we start looking at kids and younger, 10 to 19, they're actually the second lowest with 0 to 9 newborns to 9 years old as being the lowest groups of infection. Okay. So as we start looking at the right-hand side of this, we look at age groups 10 to 19, 20 to 29, 30 to 39. This is 3-week data. Okay. So now we're seeing the highest groups of infections are occurring in the 20-year-olds as well as the 30-year-olds, followed by the 40-year-olds. So that correlates with what I had shown in the previous slides of younger than 18 and looking at this age group of 35 to 44. So if we go down to the lower half on this side, we see that the highest percentage of cases are occurring in the 20-year-olds, in the 30-year-olds, and hospitalizations occurring highest amongst people in their 30s and people in their 50s. And so these are the nuances of, just saying, X number for this population doesn't tell you a whole lot. But when you start looking more, digging it more into the weeds, you get a better sense of where all these infections are occurring, who's being hospitalized, and how many admissions and how many fatalities. You get a much clearer picture of what's going on. So, Mark, Jeremiah, I'm going to turn this back over to you guys and let me know for any open discussion.
Dr. Ignace, we do have a couple questions in here, and I'm going to let Jeremiah take care of that. First, I want to take care of some business for all our Native folks here. please spread the word. There are 3 tribes in Wisconsin right now. Oneida is one of them. And they right now have a $500 incentive for you to get a vaccination. If you already got a vaccination, all you have to do is apply for the incentive and you'll get it. So for those folks that were saying, oh boy, if I held out, I would have got $500. And if I held out till now, you know, I missed it. You did. All you have to do is apply. I went through Oneida's incentive process online. It was very simple. And I'll be getting a check for $500 and no taxes off, just straight to me for getting vaccinated at the Ignace Indian Health Center, or wherever you got vaccinated and you're in the register and files. Oneida is going to check that. And again, 2 other tribes are doing it. So if you have someone in your family, you're from one of those 3 tribes. I believe it's Ho-Chunk is one of them. And I'm checking my notes here. Menominee, you might want to check out your nation as well about this incentive program. Also, those of you headed out to Summerfest, and this is a real big thing, they're going to want to see a vaccination card. If you misplaced that, you're going to need to produce a paper record of something. For those of you vaccinated at Ignace Indian Health Center, hopefully we'll get an answer right now how to get a hold of that record. Also, you can, at the gate, you will have to produce that you tested negative within the last 3 days at the front gate. I hope I got all of that in right away, because it is a big weekend. Summerfest is coming up. It's going to be pretty huge, and we certainly want to be taking care of that. Also, last thing, school starting. We have these multi-generational families. We'll be watching for that and what happens there, but please take care. Jeremiah, can we hit those couple questions here? I see them written out.
Yeah, sure, Mark. I just wanted to add too, I think I saw today that if you're going to Summerfest and you want to get, you know, you mentioned the testing, or you have to have a negative test. I believe they are doing point of care testing at the gate, but I believe there's a fee attached to it. So just be wary, or be aware of that if you're making your way down there. We had a question kind of from I think a newer attendee to our session here, Jennifer Winter, and she was asking, is there anything that the Medicaid kind of HMOs can do to help out with disparities in healthcare, or in helping with vaccine outreach for, I guess, our patients, but also I think maybe, you know, just the community health kind of FQHC patient population.
So, you know, that's an interesting question, and you know, we here at GLIC, and I'm sure this goes along with all of the other community health centers and FQHCs here in Milwaukee. You know, we do vaccines on site, and looking at how we can do outreach of vaccines for perhaps individuals who are not as mobile and are more dependent on transportation. So we recently, GLIC has recently is creating a mobile van, and this mobile van will be able to address these pocket areas, these kind of lesser areas of need. In particular, individuals who can't make that transportation, have limited options, and we're going to be more aggressively looking at doing more outreach on an individual basis, or even small group outreaches more often as the months come along here, especially getting into fall and early winter. These outreaches are going to be even more critical in addressing individuals' vaccination, whether that be COVID or pneumonia, or the pneumonia vaccine, or even the flu vaccine. That's coming up short and pretty fast as well. So the intent here is be able to reach as many people as we possibly can who cannot make it into whether it be transportation or just mobility issues. We will look at coming to you.
All right, sorry, Dr. Nace was actually typing an email to the woman who asked that question to let her know your thoughts. As we, I think this week, schools have kind of started getting back into session. University students are kind of moving back into their dorms. I think there's a lot of question marks of what this is going to look like in, a couple of weeks from now, as far as case rates and maybe hospitalizations as some of those, under 12 year kids of, under 12 maybe start, spreading it more consistently. I'm not sure. What are your thoughts on that? What should we look forward or towards in the next couple of weeks here as schools kind of really get back into full swing?
This is kind of interesting because it sounds like and feels like deja vu all over again. Because these were conversations that we're having, even 9 months ago, after the holidays, going back to school, and what does that look like? And concerns about increasing cases and so forth. And so just like any situation, there's always two sides to each coin. I know in the school district that my kids go into, there were options to either be fully masked, recommended, they called it required, optional, or remote telehealth. And it seems like the vast majority of kids in the school district that I belong to, that the optional mask requirement was the most picked option. So it looks like, and just looking at the numbers, I don't think anyone should be surprised that there may be a bump in numbers here, especially in the month of September. But when I was looking at numbers even towards the end of last school year, they're a lot more lax on the masks, and we didn't really see huge swings in numbers. Transmissions occurred, and I know my kids were in classrooms that had exposure, and in my best opinion, they never exhibited COVID symptoms. So, it's hard for me to predict, but my sense here is that I think for the most part, kids will be wearing masks. They may not be wearing it 100%. They may be wearing maybe 60%, 70%, but they're back in school and they're more active. I know my kids were excited to go back to school, and they'll be wearing masks, but they're young kids, and who knows how long. They probably will use them as chin straps than anything. But I wouldn't be surprised if there was a bump in kids in high school, elementary schools. It'd be interesting to see what happens in college age students. A good portion of college universities and even private colleges have implemented vaccine requirements. And so we may be hearing of some outbreaks, but they probably will be related to unvaccinated groups of individuals. Much like in high school, there may be a breakout here or there. I don't think this is going to be rampant through every grade, every every level of schooling, we'll be hearing about outbreaks, and we'll be hearing about unvaccinated. We'll be hearing about masks or individuals not wearing masks. But again, looking at numbers, looking at transmissions, we know that younger populations are the vast majority are unvaccinated, and we know that the majority of infections are occurring in unmasked, unvaccinated younger population. So this shouldn't surprise anybody moving into the fall.
Dr. Ignace,
Won't surprise me.
two last ones, and thanks for staying over just a bit. And these will be my two. You have the last moment. One is just a follow-up. How can someone get their vaccination records if they had their shots at the Gerald L. Ignace Health Center? And the second one is building on what you had just said at UW-Madison. Just 4 hours ago, the university posted that 90% of the university community there was vaccinated. So yeah, just let everybody know, because I know we got a lot of local kids that are in college there. And other places, if you have concerns, please contact those colleges and their health departments. That's why they're there. They answer those questions from students and parents. Dr. Ignace, back to you, and thank you for the extra time.
Yeah, right. So a couple of things. I know Marquette has a pretty high, much like Madison. I think it's about 90% as well that are vaccinated. So that'll be good. I think to the first part, you had asked if for individuals who have gotten vaccinations here. I hope everyone kept their card, the CDC card that we handed out to everyone that we marked the lot number and the vaccine and the date that it was given. That will suffice. If you don't have your card, if you got both vaccines at our facility, we could print out something. It will take us time, though. It's not a quick and easy thing that we can do because we have to take name, HIPAA, privacy issues, and make sure that we have the official record for that particular individual. So it's not going to be instantaneous. It will take time. It may take at least the full day to be able to get this, because there are requests that are coming in, a lot of requests, and so it's going to take time. We don't have a lot of dedicated individuals just to get these official, listing of who got vaccinated. That does take time. So please be patient with us, and because at the same time we're undergoing a transition into a new electronic health record system, one that'll be more efficient and faster and better customer service. So we are transitioning to Epic and moving away from the older version of IHS, EHR to the more modern, faster, efficient Epic, everyone uses. So hopefully we can accommodate people's requests as fast as possible. And my suggestion would be to create a My Chart account so we can help us make things efficient.
All right, Dr. Ignace, so once again, thanks for the extra time, and you got our last word, and thank you to everyone online here hanging with us and being patient, and we'll see you soon. Dr. Ignace.
All right, thank you, and I'm glad I'm back. I'm glad I'm actually had an opportunity to talk to people. So, this is really interesting times right now in this pandemic, because all these moving pieces, all these moving variables, we all see what's occurring outside in the general public. We all know our own level of comfort and protection, people who have been vaccinated or decided not to. How this all plays out in the month of September is going to be interesting. People are going back to sporting events, venues, Summerfest. I mean, in the most general of sense, yeah, we're kind of getting back to that normal. There is a new normal, and all of these changing environmental events are occurring almost simultaneously. So I'm happy to be speaking with you and being able to give you information to help better inform you as a person and how to protect yourself and your family. And so I'm going to be continuing to do these town halls, and I hope that everyone returns, and I'll be doing these every 2 weeks. So I'll be getting more and more updates as time goes by. So until next time, everyone stay strong.